Thank you very much, Jennifer. That applause is for you. We're also joined by two members of the cast. One that was just talking near the end about how we need humanity back, and that is Suzanna Newell. Suzanna is a triathlete who was diagnosed with an autoimmune disease and now requires a wheelchair after taking the shots. Also, we have another member of the cast. I'm sorry, Shaun, if I mispronounce your name, but Shaun Barcavage. I'll leave Shaun. I'll leave it. I'll let Shaun sort it out after. But Shaun is a vaccine-injured nurse and researcher. And we also have Christina Parks, who is a PhD in cellular and molecular biology. You may have seen Christina in the film as well. She's someone who I've gotten to know over the past few years and had the privilege of interviewing, and she's also one of the experts who has agreed to testify on behalf of Michael and Sophia in their case regarding natural immunity. Yeah. So Jennifer Sharp is an award-winning filmmaker, writer, director, editor out of LA. And I was very inspired by the story that she put together. And I've been inspired by her whole journey. And I just want to read something. Some of you may have heard me read this before, but I was very moved by this. Let me see if I can find it. I read it on the radio a few times, actually. And I would like to share it with you one more time just before we start. I found this on a Facebook page, so I was happy she didn't mind me sharing it. She said, "Okay, here goes. I've had an experience that's turned my life upside down. It's been frustrating, infuriating, and enlightening. And the therapy that I have used to get through it is to create a movie about it. Now that it is finished, I'm afraid to show it to people. And that's not right. This is my journey through a complex situation where I've discovered a lot of gray area in a place that many people declare as black and white. As a filmmaker, I understand that there are at least 3 sides to every story. If you believe there is only one side and are unwilling to hear what other people have gone through, that is a problem. If you are confident that your view is the right view and anyone else is an idiot, that is a problem. If you have a knee-jerk, defensive reaction and get hateful when you hear people say that they are sick and their lives have been ruined, that is a problem. Calling people names, division, hatred, politicization, arguing without listening is a problem. The state of this country is a problem. I am attempting to be a part of the solution and not the problem. I begin by telling my truth and sharing the things that I have seen that are shaping my place in the world right now. I am not trying to prove anyone wrong. I am not picking a side. I am just presenting my journey and all the questions that have accompanied it. If you are interested in being part of the solution, I ask that you watch my movie and listen without prejudice. I ask that you check any immediate reactions and be open to the wonder of evolving. If you find yourself shutting down and reacting, ask yourself why, and hear what I have to say. If you're not interested in being a part of the solution, then this film probably isn't for you. Humanity, compassion, empathy, growth. And finally, regardless of how you want to respond, there are a lot of very sick people whose lives have been ruined. They are in constant debilitating pain, their bodies have shut down, they are bankrupt, and they are committing suicide. It shouldn't matter if they are rare or not rare, or if they are able to convince you as to why they are sick. They are alone with no answers and no support, and they deserve, if nothing else, compassion. Welcome, Jennifer. I think we can, okay, she's unmuted now.
Yes. Thank you. Hello. We're a little freezing, but I think you can hear my voice fine, right?
No, you're not freezing here.
Okay. Okay, great.
Yeah, it's very
Great.
hot here. We don't freeze.
Okay. Well, awesome. Great. Well, thank you for showing the movie and thank you everybody for coming out and that reading my Facebook page post with such emotion made me sound very stoic and thoughtful. um, that was great. But yeah, I mean, I'll just start there with like making the movie, and that was my that Facebook post was my attempt to get my pro-vax friends to watch my movie. And I felt like I needed to write something really heartfelt to get them to watch it. I couldn't just post it because it's so inflammatory. This subject. So I really appreciate everybody coming to watch it and everybody with open minds and being a part of this community. It's very exciting that it's like international, and it's not exciting actually, it's sad, but it's the same thing everywhere. It's really nice though to connect with people in different countries and just see that this is a human issue all around, and it's going to take all of us to learn, to share, and to help. So that's my opening. Thank you. And I'm actually just really excited that Shaun and Suzanna and Christina are here. All were in the movie and had really great things to say. So I'm happy to hear what they have to say and answer any questions. But yeah, I made this movie. I pretty much say everything that I need to say in the movie. So I will pass it on
Well,
for
well,
Eugene.
well, before you exit stage left, I think a lot of people would be interested in what really drove you to make the film. Like, was there like a single event or a series of events that kind of pushed you over the line to do it? You know, was it something you thought of immediately, or was something that built up over time?
Yeah, no, I did not want to make the movie. I didn't want to get involved in this chaos of the vaccine argument. But enough people, it was me not being able to tell my story and people not listening and realizing that people didn't care. And then having people time and time again, even a year and a half after the shot started, saying, I don't know anybody with a reaction. I don't know anybody with a reaction. And I knew thousands of people at this point. I'm in a support group. And so I was like, I have to, as a filmmaker, it's my job to tell my story, and I have to let more people know that there are reactions. And I realize the people with reactions are being censored. So people honestly don't know that reactions are happening. So if I can get a story out, make a movie, and get the word out, I wanted to do that. And then at the same time, I lost my second job because I wasn't vaccinated fully. Um, and that was ridiculous. And I was finding that I had no compassion, that I was losing jobs. So the whole mandate debate here in the States and in LA where I live was just going crazy. And I found myself on the outside of society being forced out, not allowed to go to my friend's funeral, not allowed to go to things because I'm not fully vaccinated. And people didn't care because they were like, oh, well, it's the greater good that you're not allowed around and you're very rare. And it was just so much false information that I fought it for a year because I am a filmmaker and making a movie like this could affect my career. Hollywood's very left pro-vax leaning, and so I'm definitely putting myself in a spotlight, and I could mess up a lot of what I've put into. So I was fighting it, but at a certain point, I couldn't fight it anymore. You have to do what's right, and the world is presenting this big problem, and and I have a voice. So it was my responsibility. At a certain point, I was pretty much forced into it by what was happening. I couldn't close my eyes, and I couldn't not talk about it.
Thank you very much. So just to your point, I just want to ask in the audience here, with Jennifer and everyone else, could, by way of show of hands, everyone let us know if you know of anyone who's been injured from these shots? Yeah, give thanks. So, Jennifer, how has your immediate family and circle of friends reacted to you making the film? Like, what was that like?
They were afraid like my sister was very afraid, and my sister actually called me up traumatized about a month ago after that Facebook post, actually. So after that Facebook post, finally, like a few people, that was the first time I let people know I made the movie, like who I knew were very pro-vax, like publicly. And she had two people. I'm from a small town in Ohio, and I don't live there anymore, but she does. And she had two people approach her extremely worried, extremely nervous. And she called me and she was like, I'm so nervous about what you're doing. She was nervous the whole time that, like, I'd get in trouble with the government, that I was putting myself, in this situation, that I'm going to be used by the right wing media as a talking point for them. And so I have to watch what I say because I don't want to go on certain podcasts and talk about it, or the right wing media is just going to take it and go with it. So that was the fear. And I'm like, I can't be afraid. And then a month ago, after I put that up, she was approached by two people who were like, I'm really worried about your sister. And she called me like really worried and freaked out. And she's like, people are really worried. And they actually say that you're really discrediting yourself because of the press you're doing. You're doing too much right-wing press, and they read your Facebook post, but then they go to the website and they see the press you're doing, and you're completely discredited, and that you really have to watch how you're being used and who you're talking to. And the irony is the wrong word, but that's not the right word, but that's what's coming out of my mouth. The predicament with that is that the right-wing media, actually, first of all, most of my interviews have actually been people who are center, and maybe center right, but not super right wing. But like everybody's put in this huge right wing category for having this belief, and not that it matters, but it has been more center. But second of all, it's the center right and the right wing media. If I was saying no to them, you wouldn't have seen my movie. Like nobody would be covering it. I've been knocking on doors with left wing media, left and right, NPR. I've called, I've emailed, and nobody will touch it. I got a mainstream publicist who said it would be career suicide if I covered your movie. So I can't get the left wing media to cover me. But then the people on the left are like, you're discrediting yourself if you're doing right wing media. And I'm really frustrated. And I think we should be able to talk to people who have different views. We should feel safe to do that. And so I am doing it, but I'm also doing it cautiously, and I don't feel really comfortable doing it. And then back to what my family, you did Epoch Times, you did Fox News. Like I'm getting told that I'm making the wrong choices, and that I'm really at risk of being used. So it's fear. It's fear that I'm getting from my family more than anything.
Right. Because I was going to say, I noticed that no one said to you that you're not telling the truth.
Yeah. Exactly. I mean, and when I go on, and I'm always really clear politically, like I am not here to spread an agenda. I even come from a liberal side. Like, I say things like that to make it clear. And so far, none of the right-wing media that has interviewed me has used me as a soundbite, has taken anything out of context, has made me seem like, super politically driven. And so they're wrong. Like the people who think the right-wing media is using me, they're not. And what I'm saying is the truth. And it's a message about vaccine injury. It's not even being taken out of context.
Right. Well, give thanks. So, Suzanna.
Hello. 'Cause, 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 'c
I've watched a few videos of you outside of the movie Anecdotals, and as an athlete myself, you know, it's something that really your story really touched me as someone who's been extremely active all your life, and now facing this huge, life-changing challenge. You know, what has that experience been like for you?
It is extremely frustrating. I have, I go up and down. It's an autoimmune disease, so it flares. I'm currently on steroids, which is helping me like sit through and be a part of this panel today. Unfortunately, I have to use some of the medications to help deal with flare-ups, but to go from being active and to be able to use and push my body to, needing my teenagers or my husband to push me through an airport because it's just too far for me to walk. And initially I had like burning neuropathy in my right leg that made it extremely painful to walk. Now that is gone, but just the extreme exhaustion makes it really hard to stand or go far, including having POTS, that's postural orthostatic tachycardia syndrome. So really, my whole life just flipped upside down pretty much overnight. My injuries came on within 40 hours of my second shot. Actually, it'll be my 2-year anniversary on Thursday. We call it in the vaccine injury world regret anniversary because you took a shot and your life changed and then you were basically abandoned. So it's been a challenge. It's been extremely eye-opening. What Jennifer just said about media has been an interesting ride too. I happen to have voted Democrat my whole life and kind of be shunned and censored by the political party, that I was associated with. Has been heartbreaking. And then to lose friends as well who are like, why are you talking about this? Like, this is just you. This isn't happening to anyone else. It's just heartbreaking. So actually my first speech was the speech at the end of the movie, and I almost didn't do it because I knew it would be a crowd of people who had voted differently than me, and I was right. People were waving flags that were against the person I had voted for. And I'm glad I did it. I went up there dressed head to toe in purple and just said, hey, this isn't about red or blue. We need to stop picking sides and we really need to pull together and just start, focusing on the fact that some people are getting injured and we can't hide them, and we are part of the science as well. So it's been a journey. I'm thankful for Jennifer's movie because I could share it with my friends who are more pro-vaccine, and they watched it and they saw it, and I think it opened their eyes to a lot of things that aren't making it into mainstream media still today.
Yeah, thank you for sharing that. Just just one more thing. How long did it take you to get to a point where it was acknowledged that your injuries were attributed to the shot?
That is a great question. I live here in Minnesota, and the Mayo Clinic in Rochester, Minnesota is like an hour drive. And after I had been to the emergency room up here and things continued to get worse, my husband's like, oh, we need to go there. And that experience was pretty horrible. So there it was like almost like the Twilight Zone. Like they knew what was going on, but they didn't want to talk about it. They kept thinking I had COVID. And actually, I just got COVID for the very first time in January of this year. I never got COVID before. And I had antibodies in my blood tested multiple times. And also the vaccine antibodies were in my blood for like a year and a half later, which I think kept me from getting COVID for a while. But so it wasn't then. Like I was in the hospital within 5 weeks. I couldn't walk, and it was bad. I'd say though my primary care shortly after that in August. So I got injured April 2021. In August 2021, my primary care filled out the paperwork and for Pfizer and said, yes, this is from the shot. So I feel like I'm luckier than many because I was able to advocate for myself and because it maybe happened so quickly, like things went south within 40 hours and then really south within 5 weeks. But not so many people are that lucky. I did struggle significantly with a neurologist. I had connected with people online, so that burning pain I felt in my legs, I'm like, this is small fiber neuropathy, which is it presents exactly like that. So I was trying to convince him from July. It took me from July to December to convince him to do a skin punch biopsy for small fiber neuropathy. And he's like, no, I'm not convinced. I'm like, well, just do it. He's like, well, run these other tests first, which were all fine. And then finally did it. And of course it was positive, but I didn't find that out until February. So like 10 months later, I'm finally getting, results of the sudden onset nerve damage. And had he listened to me in July, I could have maybe gotten treatment right away. And I still am having trouble getting what's called IVIG. And, if we were talking about this and testing these things right out of the gate, when people have these immediate reactions, they could get the treatment and then not have this long-term chronic illness that lasts. I mean, I'm still in it, right? It's 2 years. So that part just breaks my heart, especially with younger people and children having issues. It's not right. We need to talk about it. It's ridiculous that it's been this long and it's just been censored so much.
Yeah. Well, thank you again to Jennifer and to all of you, because this event is actually the start of the conversation about vaccine reactions in Bermuda. There has been no conversation prior to this, and no one is collecting data because it doesn't exist. So greetings, Shaun. I just want to talk to you about, obviously you're a nurse and a researcher, so if you could help us to kind of understand, like, what led to you actually deciding to get the shots, and then what your experience was like after, having them. Because obviously being in a medical environment, I guess that area was highlighted right at the beginning. So interested to understand what your experience was in that regard.
Hi, hi everybody. Thank you to the audience and everybody who came to see the movie. Yeah, I think my experience is a bit unique because I am a researcher and I do work on clinical drug trials, including the vaccine trials for COVID, in fact. And so because of that, I knew more than anybody that when things go wrong with any drug, it's a terrible place to be. But with vaccines, it's even worse. Because with most other drugs, you have recourse for action. You can sue somebody if it's proven something went wrong and there was gross negligence. But with the vaccines, especially COVID vaccines, they were given almost complete total freedom from liability. And I think for me, ending up in this situation was a shock for me because I never imagined. I've taken every vaccine required of me my entire life, and being harmed by this was the shock of my life to find myself in that situation. And the second shock was the reaction of my fellow colleagues in the field of medicine. So I struggled for months to get anyone to recognize what happened to me, even though I knew professionally what was going wrong and I could articulate better than anyone. I still faced barriers and doubts and disbelief and fear of recognizing it. So I think, it's a bit of a unique situation to be someone who's been very in the research, in the science of all of this, and then actually get injured by it. I faced a lot of ironies.
What is your thought now about the safety systems that have been put in place to protect people from medical interventions? Have you found, I guess, the administration of those things or the acknowledgement of the safety signals? What's that experience been like for you around COVID versus around other things?
I mean, for me, it's been another shock, because we all have this faith in the system, and then I had to interact with this system, with the CDC and the FDA, and the responses I would get back were shocking, almost just pure denial or disbelief. What was happening could be real, or you're rare, or it's coincidence, or we're not seeing it, even though I knew that they were seeing it because I was seeing it. As soon as I was injured, my initial instinct was to go and find other people like me. So I set up a support group online very early on just for people who suffered with tinnitus, which is one of the severe afflictions that I have, this ringing in my ear. And within months, I had thousands of people joining this group. And so I knew that it was real and it was happening. And through there, I found thousands of others in other groups with neurological symptoms. And then others in other groups with cardiac symptoms. And then some people with a combination of all symptoms like me. And so I knew the data was there, and if you look at VAERS, the system for collecting that data in the US, you can see the numbers there, but it's been weaponized. So if you tell the government, yes, hey, the numbers are there, they'll say, oh, well, anybody can report to VAERS, so it's inaccurate. But then if they want to use it themselves to say, there's only a few of you in there, so you're rare. So on one hand, it's inaccurate, but on the other hand, it's accurate when it's convenient. And so that was one of the shocking things that I experienced. That and just the total lack of research. So in the United States, what I have learned through this is you are better to be diagnosed with terminal cancer than a vaccine injury, because there will be help for you. There will be research for you. There will be doctors for you. There'll be a diagnosis for you, a prognosis for you. There'll be people running marathons for you. When you're vaccine injured, you're basically erased. No one wants to deal with you. You can't get on TV to advocate for yourself. With the COVID vaccines, you cannot sue anyone. And they've been put into a special program for compensation, and that program doesn't work. 97% of the claims are rejected, and the burden of proof for me to prove that the vaccine did this to me is so high that it's almost impossible to prove unless it's something the government says they've seen happen.
Very
But
disheartening.
nobody knows this, right? Because no one wants to talk about it. And for me, this isn't like, Jennifer and everyone else's, this isn't a pro-vax or an anti-vax. I just deal with the facts of what happened to me, what I experienced through this, the troubles that we face, the problems in the system. They're all facts. You cannot deny it. And that's where the path that I walk and I focus on.
Thank you, Shaun. Yeah, and just for context, if you look at the open VAERS website, which kind of makes it easier for you to go through the various data. Um, it's kind of even hard to describe. Initially, it was like, well, the number of reports of adverse reactions equals more than the total of reports in the last 30 years. But now the difference is so huge that I can't even put a number to it. It's like water trickling down your driveway, right? And then it's like an iceberg melting.
Yeah.
And it's
And
plain as
imagine,
day to see.
No doctor reported me yet in VAERS. So imagine how many others are unreported. When we look at you're stating that there's so much reporting,
Right.
I'm still not reported there by the medical community, along with thousands of other people.
No, I'm not as well in VAERS, even though my doctor filled out the Pfizer paperwork, never made it to VAERS.
And again, just for context, historically, the reports in VAERS generally range somewhere between 1 and 10% of the actual cases. So, Dr. Christina Parks, thank you again for joining us this evening. You have a PhD in cellular and molecular biology. And for the past few years, most of us have probably talked about cells more than we've ever talked about them in our lives before. We've been, people have been subjected to this new technology, this mRNA. It's been all these conversations about it changes your DNA, it doesn't change your DNA, it's safe, it's experimental, it's not experimental. So we're here tonight with people who have been injured. What is your understanding about what about this new technology that is causing these problems in people, and how have you found yourself positioned or within this whole COVID pandemic experience? Oh, you're still muted. I'm sorry.
Okay, sure. So my graduate research was in cytokine signaling, and so I studied the immune system. And back in the 90s, when I was studying the immune system, I saw a lot of vaccines being added to the childhood schedule. They didn't make a lot of sense to me because we were still cloning the receptors of the immune system. So there's no way we could know the real life impact. And so that's why it was always really important. And there wasn't this safe and effective mantra back then. It was really understood that there was a cost benefit and you really needed to make sure that it was on the benefit side. So that said, I have had concerns about the vaccine schedule for quite some time. And about 6 or 7 years ago, I started researching it intensively because PubMed was online. And I've researched it about 20 hours a week for the last, 5 to 7 years. And the more I researched, the more disturbed I got. And I know many of you are saying, well, I'm not anti-vax because, well, yeah, we're anti-vax. We want safe, effective vaccines. That's not, anti-vax. But it's a pejorative to marginalize people. And so, but everyone wants people to hear them. So they want to say, I'm not anti-vax. But, I have friends who took their 3 triplets in to get 1 pneumococcal vaccine and watched all 3 regress into autism within 48 hours. My friends have children that have died from vaccines, and the numbers are much less, but this has been going on for a long time, and those people have been completely marginalized and erased from society. So you, for all the vaccines you're injured, you are not the only one. And many people I've had tell me over and over again, when they understand how problematic this is, they're going to listen to us. And I'm like, we have been shouting for a very long time. So I don't have a horse in this race. I don't have a vaccine injured child. I'm not vaccine injured myself. And so I was following this when they came out with the COVID vaccine. And when they came out with what they were going to do, they weren't out yet, that it was experimental gene therapy. I recognized it as experimental gene therapy right away. And I was stunned. My jaw dropped because there was huge problems with inflammation, anaphylaxis, cancer when they were piloting gene therapy. And that's why you don't see anybody doing gene therapy nowadays, because they just could not seem to make the technology safer enough. And so now we're going to give it to healthy people. And honestly, I was lecturing. I was trying to tell people this is so different. Do not do this. This is an experiment. There are so many um, potential side effects. You're basically making your body make a foreign protein that the body is then going to attack. And so it's going to have like an autoimmune response. And it's going to be so detrimental. And of course, I was highly censored, highly censored before anyone even knew who I was. And then everyone ran out and took the vaccines, and I mourned because I knew that this was going to be catastrophic, and it is catastrophic. Because it's so censored and we're marginalized, people don't know. But we're talking about 80% miscarriage rate in the first trimester. We're talking about fetal death is usually at 6 per 10,000 live births. In Canada, where there are vaccine mandates, it's 160 per 10,000 live births. So we're talking about, and when we talk about vaccine injury that's being reported to bears, they're not reporting the cancers. They're not reporting many of the heart attacks. Current studies put myocarditis somewhere between 1 in 43 to 1 in 100 for our youth. So how many, myocarditis, many studies show 50% mortality 11 years out. So this is a catastrophic event, and I've never been worried about what people called me. I'm a scientist. It's my job when you come to me and say, hey, this happened, to figure out why. And so that's what I'm doing. I'm trying to figure out why, and I'm trying to figure out solutions, because if we wait for the establishment to help us, we aren't going to get any help.
And one thing that comes to mind with all of this is who actually agrees with the way all of this has been handled, and why are people defending these products? Are they defending the pharmaceutical industry, or are they just afraid? Like, it's very difficult to understand. Like, what's been your experience with that? And this is for any of you can.
I would say that they're defending their way of life. They don't want to have to admit something catastrophic is happening, because then they would have to do something about it. And it seems complicated, and it seems risky. And so they don't want to actually, like many doctors, even at the childhood vaccines, many doctors would not look at the data. I'm a PhD. They won't look at it from me. They won't look at it from anyone, because when they do, they're responsible for it. And it might necessitate a change that they are uncomfortable making. So many people are choosing to look the other way or ignore things because it would be too uncomfortable to look at it.
To add on to that, I've often said this is a pandemic of trauma created by fear. So much fear was put out there in general, and a lot of people latched onto this vaccine as our way out of the pandemic. And anyone who came up against, hey, wait, this vaccine is actually causing problems, significant problems from previously healthy people, it's uncomfortable, to use Dr. Parks's words. We're an uncomfortable truth, the fact that people are getting injured. And I think since we're censored so deeply too, it's just easier to look the other way. I have to say, my eyes have been open to all institutions. And before, I was marching along with my life, thinking that these institutions had my back. And now I know better, but it's sad and lonely to be in that place too. It's easier. It's less traumatic to realize that, you're on your own. So I think this pandemic of trauma just kept people from seeing us and hearing us and admitting that there's something big to be looked at here.
So just so you guys know, we're gonna we just put the mics out so we can pick up some questions from the audience. I just had a couple things. Some people sent in some questions I just want to ask really quickly. But one question to you, Shaun, Suzanna, or Jennifer. What has this experience taught you, and how will you endeavor to move forward in your life as a result of what you've experienced? Go ahead, Shaun. Yeah.
I think this has maybe not necessarily taught me something, but I think it's shown me inner strength that I never knew that I had. I must say that I'm now 53, and I have cried probably 3 or 4 times a day in the first year of this trauma, and I just kept going. And with determination, I thought, well, I'm a nurse, and really my first duty is to patients. And so, well, even though I was disabled, I thought I have to reinvent myself, and I have to really turn something really horrific into some and find some good in it. And so that was really, I think, what this experience has shown me. I think it's like Suzanna, it's taught me that there are failures in government systems that definitely are eye-opening and need to be repaired. But for me, it's all about how I can survive every day and help the others who have been injured to survive.
Yeah. So thank you, Shaun. Suzanna or Jennifer, how are you choosing to heal from what has happened to you? And does forgiveness play into that healing? Jennifer.
I'll let Suzanna talk about how she's choosing to heal, maybe if she feels like it. And I'll say forgiveness is a big word for me right now. All around. So I'm finding myself with this movie. Like, it's funny. I feel like I left one tribe, but I'm slowly finding myself in another tribe, and I don't want to be in any tribe. And neither of the tribes can forgive. Neither of the tribes have empathy and compassion. And that is my biggest thing I'm saying right now is we have to not worry about being right, and we have to understand other people's points of view. So because I'm doing a lot of right-wing media, whatever that means. We know what I'm talking about though. But because I'm talking to a lot of people who chose not to be vaccinated, I'm hearing a lot of anger from them in my when I do podcasts, when I read the comments, where some people are even going so far as to say, well, anybody who got vaccinated and was stupid enough to put a foreign thing in their body deserves what they're getting. It's the reckoning. All the morons will die. I'm hearing that a lot. Which is the exact same thing that I heard from the other side back when they were like, the morons aren't getting vaccinated, so the people who are not getting vaccinated should die, and it's weeding them out. And it's just this interesting thing where I'm hearing echoes from both sides shifting depending on what's going on. And I just want to scream out to everybody, blame is not going to solve anything. Understanding that everybody has a reason and everybody has what they've been fed. And with this forced censorship, it makes sense to me why anybody would believe anything. It does, because I understand people are busy. People have kids, people have jobs. They can't spend 50,000 hours like I did, once I was injured, getting to the truths of things. So these people who are going through and trusting their governments, their newscasters, their doctors, trusting their doctors that they've gone to for years, I don't blame them. And it's not really for us to blame. And so the forgiveness thing is a huge thing where it's like, just if you were right, good for you. You were right, but that doesn't help now. And I think you were also hurt probably because if you didn't get vaccinated, you were called a moron early on and you lost your job. And so how do you forgive people who were like, who were telling you to lose your job? And it's a hard thing, but I think we all have to reach inside. And also, not everybody who got vaccinated, just because they got vaccinated, didn't mean that we were pro mandate and telling you were a moron for not being vaccinated. There's just a lot of levels to humans. There's a lot of different people. And if we take out the sides and we take out I'm on this side, you're on that side, and we just mix it together, then I think forgiveness becomes a part of it. And forgiveness and coming together and unity is the only way that we're going to move forward in a positive way.
Give thanks, Jennifer. And just before coming to you, Suzanne, I in a recent interview, I shared that from what I've seen the past few years has just highlighted how terrible we can be to one another. Yeah, it's really been sad. I know that's a hard act to follow, but Susanna, did you have anything to share?
Yeah, no, just to add on to what Jennifer said, I feel like this pandemic of trauma that, Jennifer, you talked to it really well. Everybody experienced trauma during COVID. Some people lost their jobs, some people lost their businesses, some people lost loved ones to COVID. Like everybody experienced loss in the past 3 years. And instead of having empathy towards one another, I mean, I think certain things we're getting empathy, people who lost loved ones to COVID, but, those of us who are injured by the vaccine, absolutely not getting empathy or getting hate kind of from both sides. Like, well, you deserve to die because you got the shot, or, you deserve to die because you're scaring people from getting the vaccine. So I think it's very easy to hate people from afar, hate people from behind the safety of a screen. But when you really get to know somebody and you can see their pain and hear their trauma, I think it's harder to hate and easier to get to humanity. I'm wearing my Minnesota Team Humanity t-shirt. So I think it's about seeing each other's pain. It's about making kindness contagious instead of this virus. If we could just take a tiny bit of how contagious the virus is and turn it into just a little bit of kindness, I think we could do amazing things. But people are very divided, and I think that is just a distraction. And if we were able to see each other's trauma, I think we could come together and demand more from the pharmaceutical companies, demand more from our governments, make sure that where there is a risk, there needs to be a choice. So in that case, mandates do not make sense because there is a risk. We're living proof of that.
All right, thank you, Susanna. So I want to open up to the audience. I saw a couple hands earlier. I see one here, smiling. The face is smiling, not the hand. Yeah.
Hello?
Yeah, there you go.
You can hear me?
Yeah.
I have a question for those who are vaccine injured about, have you looked into...
Speak up a little bit.
Have you looked into your batch number
Oh.
and looked at...
I'm sorry. Could you stand up? Because there's people watching this as well, so I'm sorry. Yeah. I'm putting you on the spot, aren't I?
Yeah.
Yeah.
Have I
Thank you.
just
Yeah,
given
you can
eye?
do like that.
Okay.
Thank you. Yeah.
I have a question about whether or not you've looked into your batch numbers and tried to see how many others in that batch number were injured, and then if it's a batch number that had a lot of injuries, if you are gathering together to create a class action suit.
I can talk to that one just quickly. Ernest Ramirez, his 16-year-old son, died, and he happened to have the same lot number as my second shot. So I'm also connected with like 5 other people who I know were injured from the same shot, and both of my shots, my first and my second, were higher on the list. So we have connected. It's pretty tough to get anything moving with that, but absolutely there's something to, the shots. 5% of the shots, I think, make up 90% of the adverse events reported in bears, if I'm correct.
Yeah, thank you. Any other questions? Yeah.
Hi, it was an
Could
amazing
you stand up?
movie.
Could you stand up, Camilla? I'm sorry. There you go.
It was an amazing movie, and it was really inspirational to hear all of your stories, and especially after the movie in this setting. I was wondering if anybody had tried, like Dr. Peter McCullough's formula for the spike protein with the nacanase, or if you had found anything else that was helping you, that people could benefit from knowing about who may also be suffering.
Okay, Shaun.
So since I was injured, I've followed pretty much all of the therapies, and in fact I've probably experimented with myself more than most. So I've had plasma exchange twice. So I was admitted to the hospital 2 times for 12 days each. I've had immunoglobulin therapy. I've gone to functional medicine, and I've had ozone treatments. I've tried all kinds of homeopathic remedies. I think the situations are very complex. We're not all the same. We look alike in some ways. We overlap. Some of us are more cardiac. Some of us are neurological. It's a real diversity of things that have happened to people. So I don't think there's any one answer. Some things just seem to work for others, but there isn't really a magic recipe right now. In fact, I just got out of the hospital 2 days ago. I had to have a cardiac ablation because one of the symptoms I had is cardiac arrhythmia. So,
Thank you for sharing that, Shaun. I just had a
Um,
quick question. Go ahead, Dr. Parks. Yeah.
So I have a Vaccine Injury Treatment Alliance, and I've been studying the different healing modalities and different protocols since the very beginning. And I would just like to echo what Shaun is saying, that my feedback is that it's very complex, and people tend to get better, and then they get worse, and they get better, and then they get worse. And even 2 years out, they're still making the spike protein. When you have the body making a foreign toxic protein, it's extremely problematic for many different reasons. Many of it might be autoimmune, and it's very, very hard to get IVIG. And even the IVIG that's out there is extremely problematic. So this is a really complicated problem because the systems are so dysregulated that anything can kind of throw them into a downward spiral. So I just like to echo that this is not, solving this is very complex and multifactorial. And these systems are just right on the edge of teetering out of control, which makes it hard to do any treatments without triggering the collapse of the system.
Right. Just a quick question on top of what you just said. Has anyone identified when the body stops producing the spike protein yet, or when Wow.
No, they haven't. I mean, it's probably batch specific, and the people who are injured got really good batches that were really highly effective at getting into cells and having cells make the spike protein. And it looks like the myocarditis isn't just, usually myocarditis is one incident and then your heart can kind of recover. No, these cells continue to make the spike protein. I just had someone tell me they were making spike protein still. So fortunately, like maybe in a lot of people, they got batches where they don't make as much spike protein. And so maybe they're not making it, but as far as I know, there are still people's bodies making the spike protein 2.5 years out.
Right. Any other questions in the
And
audience?
that's not to say all injuries are from the spike protein. It's clear that the nanolipid particles, some of the neurological issues and some of the myocarditis, the acute problems are probably from the nanolipid particles, if you're talking about within a week.
Thank you, Dr. Parks. Yeah. So we had another question that came in, and any of you can take this on. If you had all the funds to work with, how would you go about bringing those responsible for these atrocities to be accountable for their actions?
I would just like to say, if I had all the funds I could, I don't give a about them. I would start running clinical trials on every protocol that I could figure out to try to help the injured. It's
Mm,
just that simple. If I
right.
money, that's what I do.
Give thanks.
I
Shaun.
was going to add, I think what people don't understand is that you have zero recourse you have no legal options in the United States. So even if it was a bad batch, if somebody injected it directly into your vein by mistake instead of your muscle, on every level, the freedom from liability is vast and it's unprecedented. And that's because of the emergency use. So unless the the United States Congress changes the law, you have no option, unfortunately.
Wow.
That is what people don't understand, is that the problem with the mandate, well, some people think, yes, it's mandates can be good in emergency pandemics, because you want to end the pandemic, so you want everyone, as many people, to get vaccinated as possible. But what people don't realize, and as somebody who's a researcher and works on experimental drugs, is that you have to give people informed consent, right? The only message that was blasted on the TV was safe and effective. They forgot the part where that tells you have no recourse for action if you are harmed, that there is no research for you if you are harmed, there is no medical care for you if you're harmed. They forgot that. And then they forgot to tell you that you take 100% of the risk, and that the manufacturers and the government have zero risk and zero obligation. That's called informed consent. And that is an ethical right for humans. And I was appalled at the messaging. And I realized what they were doing is just trying to get people to take it, and had a very mass media message. But I do believe when you go to get any medicine in your arm, especially a vaccine, you have the right to fully informed consent. And I think if people knew those things, of course they might reconsider, right? And so it was conveniently left out.
Mm-hmm. So taking that in mind, and I recognize the time is going, so I want to kind of get some closing statements from everyone. But, I want to talk more about solutions or next steps, what suggestions each of you would have for the listening audience going forward. And Shaun, just in response to what you said just now, what comes to mind is like, if we all recognize that everyone had the right to informed consent that was not given, then is there any steps that can be taken to address that? Or is that also something that is totally, off limits?
No, because technically they probably have given everyone, maybe not even though, but the freedom from, there's no recourse for that, even though you may not have been given an official paper. Some people have looked into that, but I myself at my hospital, I had to sign something when I did it.
Right.
Some people did and some people didn't.
Right. Yeah. It
But-
makes you wonder, what was the point of the Nuremberg Code?
Mm.
Yeah, it really does. So, we have some more questions. I'm sorry. One in the front and one in the back, so we can have one of the other mics come to the front. Yeah. Yes, greetings. Oh, is it on?
Yeah.
Yeah, go ahead.
Okay, there we go. Yeah. I have a question because Shaun, you explained to us that in the U.S. they've established that you won't have any recourse taking these manufacturers to court. That's fine for the U.S. What I'm not understanding is, why does that apply to other countries? As if the U.S. are able to tell other countries that they have no recourse. Why is it that the other countries are accepting what the U.S. is pushing in our face? I know that's a difficult question to answer, Shaun, but that's what comes to my mind. I'm not America. This is Bermuda. America's laws don't apply in my country. I don't have to do what you say. And it's many countries that are that way. So I understand it's kind of unfortunate that America finds theirself in this predicament. But why do I have to be in this predicament? This is not America.
Right.
That's my question.
I think that really goes to the WHO and their push to end the pandemic, one. And then two, I think every country makes their own deals with the pharmaceutical industries, right? So like for India for example, they didn't like the contracts, the contractual obligations with Pfizer, so they declined. And India did not offer those vaccines. So it's really comes down to not necessarily what the US government is pushing, it's really what the pharmaceutical industry and the contracts that they make with the individual governments. And because everybody, I think the governments, there was so much unknown in the beginning, right? There was mass hysteria and mass fear. And I think the world was afraid of a collapsing economy and the ramifications of that. So there was a rush to find something like the golden egg, to really end things. And I think that rush may have been a mistake in some ways. Too fast, not enough data. But there are people out there who will tell you the opposite.
Right.
But for me, I really believe a 6-month clinical trial for a new platform for a vaccine is not sufficient. You don't have long-term safety data in humans, no matter what anyone tells you. Factually, you do not. So unless somebody can produce a document showing me the use of an mRNA vaccine in humans for 10 years, it doesn't exist. The FDA told me we're learning as we go.
Right. So I guess to answer your question, we have to determine what deal was made with our leaders in Bermuda. So please make note of that. Yeah.
Eugene, I must commend you for your very lucid explanations and questions and participation that you've offered us. Jennifer, it's fantastic that you have reached out beyond any normal person's reach to present us with what we've seen tonight. But, recently, the Supreme Court of the United States made a decision on Roe versus Wade on the question of abortion. The legislators tried to prevent that from happening, and it was the Supreme Court decided we have a right to oversee even and override legislation. You can see what's happening now in Israel, where they are trying to, so the government is trying to reverse the power of the Supreme Court. It isn't that we will succeed in getting the court decision, but the process itself would bring about a discussion that's needed in the United States, around the world, on this subject. And I think that somehow or the other, there needs to be coalesced a group that will assist in bringing that process to the court itself. Shaun, I know that you say that, we sign documents, we do this and we do that. We know that there was legislation, Roe versus Wade, and the whole question about abortion, but it got to the court. So there's a precedent for this. And it seems to me we should take that precedent and go to the various committees that take matters to the courts themselves for freedom and justice of people, and have the people and encourage the people to have their rights heard If not, this thing is going to die, and it will do damage, because the next time this happens, they'll use the same method. It will go to sleep, and then you wake up, you find out you're right back at it again. So I hope that in even little Bermuda, you know, we are 60,000 people here. For every one Bermudian, there are 60,000 Americans. So when we do, what we should be asking our government, and we have the means by which we can extract information from the hospital, we should be asking the government, even if we have to get it by right of PAPA, asking for information about what's taking place in Bermuda, and maybe use Bermuda as a test example of the damage that's been done, and they can prorate that into the American system. So we shouldn't just give up and say, well, you know, we've reached a deadline or dead end, and this movie gets lost, which I think it's incredible. I remember watching the movie called Gandhi. In fact, and I spoke to Edinburgh when he was going to get his award. And he said, you know, this movie spoke enormous things about the atrocities and the damage that individuals can do to other individuals, and how he fought. In fact, it cost him his life. We will all live through this. But our grandchildren will suffer because we don't know the genetic effect that what's been done is going to have on the next generation. So I encourage all of us in this audience tonight is to start talking, have the conversation in Bermuda. If you're going to let us have your movie again, instead of charging, what we should do is to put a big screen up, maybe at the National Field, and invite the public to come up and see it.
Okay.
It's, you know, they say from little acorns, great oak trees grow. We can be the little acorn because this lady here has bought, and all of you have bought us the inspiration, not to just come to this function tonight, enjoy the atmosphere and the information, and go home and go to sleep. This should wake us up, bring our nervous system to a point that we're prepared to make the sacrifice to bring forward a program in Bermuda that's going to be asking the questions, forcing the government, and the nice thing about it is we're very small. We can have an effect on the government if they don't provide us information. Your vote counts. It might not count in America, but it counts in Bermuda. And you want to sit back and do nothing, you'll get nothing results. So thank you so much, all of you, and all those who participated, because I want to let you know that this has been a very special night, and thank you very much. Eugene, I've always had a great respect for you, but boy, it's sure gone up tonight. Thank you.
Good thing.
I would like to point out that one of the key issues is the lack of liability. There's no liability for any vaccine on the childhood schedule. And if it weren't for that, that is what allowed the pharmaceutical companies to generate the kind of income that allows them to control the media and to control basically governments because they have that much money. And basically having no liability for anything on the childhood schedule and having them mandated allowed them to generate that kind of income. So I think a really key thing is making vaccine manufacturers liable again. And I think that that's something that can be very common ground. You know, just asking people, do you know that if your child gets a vaccine, that the vaccine company is not liable if something happens? Is that okay with you? You know, because I think if enough people understand that and demanded that there be some liability, that there be some accountability, then we might see a shift.
Give thanks, Dr. Parks. Yeah. Suzanna, any closing remarks from you? Oh, I'm sorry, it's another question. Oh, my apologies. Oh, 2 questions. Okay.
Can you hear me?
Yes, you can speak up a little bit more. I know you have a very soft voice.
I can. Okay, I hear it now. Thank you all so much. Your documentary is so powerful. I had to step out. I've seen it previously, but I had to step out this time because it's just so heart-wrenching, the reality of what's happening. Yeah, thank you all for sharing your story, because this is how we need to get the word out. And I just wanted to let you know that the gentleman that just spoke is a former leader of Bermuda, Sir John Swan, if you didn't know that already. Okay, so it was hard for me to formulate my question, and it's connected to what the gentleman and what Sir John said. It's about bioethics, and it's related to what you said, Shaun. I still don't really know how to ask the question, but when I did my research a couple of years ago, I found that in the Covenant on Civil and Political Rights, Covenant on Civil and Political Rights, and it's an international covenant, it says that even in times of emergency, that we have the right of consent, free and fully informed consent, even in times of emergency. So I was looking for recourse that supported that. And then along with hearing that they're saying that the pharmaceutical, the manufacturers have indemnity, I think that's what you call it. Just straight up for me, as I said, because I don't know how to ask the question, it sounds like they're breaking the law, just period. So instead of us continuing to say that, it feels like someone needs to come forward and just say that you've broken the law, you've committed fraud, you've coerced and duressed and forced people to take an experiment that we don't know the risks or the benefits for, and obviously they suffered injury. So I guess where's the accountability? But I also want to say that that law is there. It's there, and no matter what they say, so that they can push this forward. All of these laws say that no laws made thereafter, and I say all of these laws, I mean based on the constitutions, the states' constitutions in all the states around the world, including Bermuda. None of the laws that they make after the original base law, the Constitution and the human rights, can be repugnant to the human rights.
Jan, just your question.
That all is my question.
Right.
All of that.
Okay. All
I
right.
think I can respond to that question really quickly. I think you're right, and there are lawsuits that are happening. And I think the more lawsuits that come up, they do two things. One, they bring awareness, and two, we get further in the crack. There are lawyers and counsels who are suing the FDA, who are suing the government. In the movie, Brooke Jackson was the whistleblower at the beginning in the trials. She was the one who worked in the trials, and she has brought a lawsuit against she actually just went to court, and her case was just thrown out, and I haven't read the fine print, so I might get something wrong, but she was suing Pfizer and the FDA, I believe, on behalf of the US government. And so it's like, it becomes this tricky thing. Like, how can you sue? You can't sue the government, but you can sue the companies. And she had proof of lying. She has photos, she's just got a solid case. And at the end of the day, I think last week or 2 weeks ago, it made it to like a couple different courts, like it passed a few different judges. And I believe 2 weeks ago, it was actually finally thrown out by the court, saying that, and I think the reason had something to do with in a state of emergency, those standards don't need to be followed. And it was something to that extent. I don't know the details, but just catching you up on that, but also that there are people suing, and even if and her lawyer actually said, I'm sure they're going to keep going, but her lawyer said the point wasn't to win. The point was to magnify the voice. Right. And so that's what we need to know, is like, whether we'll win or not. Yes, it's illegal, but we also know that you can't beat the $1 million pharmaceutical companies most of the time. You can't beat the government. People will lie. Things aren't fair, but it is worth the effort. And then finally, like on that same token, we found out that that Robert Kennedy is running against Biden in the United States, which to me is really exciting because whether he wins or loses, I think he's going to bring a big platform to the vaccine discussion because he's a really big advocate of that. So it's really about, what the gentleman said earlier too. It's about just keeping the discussion going and keeping it through lawsuits and not being so afraid if you lose, but making the battle. And if enough of us do that, we might actually make a change and chink some armor. But things aren't fair. And just because it's illegal doesn't mean that we'll win, but winning isn't necessarily, the only outcome that's positive.
Yeah, give thanks. And thank you very much, Jan. Thank you very much. Okay. So we have another question. Go ahead.
Testing 1 2. Yeah.
Okay, testing.
Right. So I have one question. I know people probably get mad. I don't care. So Justine was just saying how we are all we're all allowed to have a decision making within ourselves, free will, right? Having said that, I don't think it has to do with government. I don't think it has to do with any sort of laws put in place that we're living. I think as human beings, we know right and we know wrong. So I'm going to say this to the panel, people on Zoom. You knew. You made a decision. You've come to the cast looking for results. I understand that. However, I feel like there won't be results. I feel like you've made a decision, and now we all as a collective have to move forward with the decisions that have been made. And we all now probably have to correct where we can, right? I forget what I was going to say. What I wanted to say was you all made a choice. You had free will. It had nothing to do with your governments and your laws and none of that stuff. It's you as a person. You knew as a person. You knew. You knew the consequence. You look in the mirror at yourself every day. You make choices in the mirror every day. Should I do this? Should I do that? Will it come with this? You knew, right? So for us to carry that extra burden, I don't think it's right. I'm sorry. I'm just saying, we'll help you, but at the end of the day, you knew, and I think you all have to come correct. You have to confess and say, you know what, I was wrong, and some of you guys were right, and whatever. I'm just saying, like I said, people will be mad, but I said what I had to say, and that's how I feel. This is a platform where you can come and say how you feel. And so I'm going to say what I feel.
Well,
thank you very much.
They knew it was experimental.
But I don't hate anyone.
oh.
I love people. I love everyone, and I'm here to help. But at the end of the day, you have to understand.
Well,
Pardon?
thank you. I know we got the question. We got the
point
question.
is-
Yeah,
Go ahead,
I
Dr.
would
You
Parks.
make a human choice.
One, as a molecular biologist, there's very few people who really understood this vaccine. Not your doctors, not the people, not the heads of the medical center, and not some of certainly not Trump. So what you think they knew, I don't know what it is you think that they knew. So people did not know, first of all. And second of all, this was mandated. And so there were a lot of single parents who, one, didn't know, right? I'd rather have my arm blown off than get the vaccine, but I knew. A lot of single parents, a lot of people took this under duress because they had people that were depending on them. And they were playing, and some of them maybe even did know that they were playing Russian roulette, but they had to do it for the sake of their family. So I think that it's a lot more complicated. I'm not here to judge anybody, but I think that what we do need to do is look at how this was allowed to be propagated upon us. Because remember, we had safe, effective treatment, and that the government did know, but the pharmacy wanted to make their money.
Right.
I would add to that just one other point, that there's another part to knowing, which is knowing that if something happened to you, then you were out of luck. Like, frankly, it's unfortunate, and I guess I was very naive. I'll admit that. I would have thought there was a safety net of sorts. I live in Minnesota. The Mayo Clinic is here. I would have thought they would have started studying reactions. So I think there's a lot of knowing that I feel like people still don't know. And then I feel like Jennifer Sharp's film actually helps to educate. It's educated a lot of my friends who didn't know until I told them, like, hey, look, if something happens to you, you're out of luck. You're going to have to burn through your own savings account for medical help, for alternative treatments. I think that piece people don't know. And I think it's important. I think the gentleman before was talking about, gathering in a courtyard or whatever, and making sure people know this. I don't think people do know. It's so censored. Knowing that it was new, the treatment was new. I think we did know it was new, but just the whole overarching knowing of what might come about, I think, is something that I today still try to let people know. Hey, by the way, if something happens to you, you're on your own.
Mm. All right, thanks. We have one other question.
Yes. I just want to just say how I'm glad that this is actually happening. And I think it stretches far beyond COVID. We have other situations and we have other medical conditions that are experiencing the same hypocrisy, if you want to call it that. We look at lupus, we look at a lot of different ailments where people have under duress accepted that science has told them that this is what the case is and this is the medication. So you may have one person that has opted that if I have a 50% chance, I'm going to take my 50 and I'm going to treat myself holistically. Then you have another person that is trusting of doctors and science that has been provided to them, and they take the medication and they might have adverse effects and may lose a kidney at a young age or may have, ongoing onsets of other different ailments and have medication that's being prescribed and offered to them to treat that has caused other sort of ailments. And I think it's time for us to advocate for ourselves, number one, because I think we've been too trusting as a society. I think doctors have been removed from saving patients, and now it's become a multi-trillion-dollar business. And I think we have been almost been put in a category of collateral damage. So I think it's time that we start educating ourselves and advocating for ourselves and not trusting that the doctor's going to have our best interests in mind. This is in no way, shape, or form anything against doctors, against Western medicine. I have always advocated for myself in feeling that I have managed my body and my life this far in my life, so I just felt that it was my option. I think everybody's entitled to their own option. And I don't think it's about casting blame on anybody that has put their trust in somebody to be at heart of, being in their best interest in what they prescribe them or what they advise them. I think it's just a matter of us going forward to recognize that mistakes have been made. Some of them are uncorrectable, but going forward, we can start looking at, okay, that maybe we can't always trust what's been given to us, what's been told to us, what's been advised to us, and what's been prescribed to us. But to move forward and support each other and start advocating for ourselves and asking more questions.
All right, give thanks. And we just have one more question right in front of you here, Mara. Yeah, and then we're going to get closing remarks. Yeah.
Good evening, Dr. Parks. This question is for you. I've recently been reading information that suggests that mRNA technology will be used in all vaccines going forward. Is this true, or can you shed some light on that, including
Sure,
childhood,
I think that
vaccines?
was definitely the plan. And so it's a very simple platform to get up and running, so they can have the flu vaccines or whatever other kind of vaccines up very quickly. And the AstraZeneca and J&J models, they could actually put multiple vaccines in that platform. So I think that is their plan, or was their plan. I don't know, in the wake of so much vaccine injury, if they're going to push forward with that or not, because it's going to be so controversial. I don't know if they'll try to wait, but I do think that that's the plan, and these are clearly not safe more and more and more, just an avalanche of data is showing that so much of the injury is caused by the body making the toxic viral foreign spike protein, causing the body to basically attack itself. And there are many other ways that the spike protein injures. So, like, this couldn't be a more astonishingly bad idea of having the body make a foreign toxic protein. And so, why would we ever want to do it again? So, I think it's time to stand up and say no to that. But I think we will see it. I don't know if it's going to fly or not, because people do realize that the vaccines didn't work as well as they were supposed to. And so there is at least a little bit of skepticism, even in the mainstream.
Yes, thank you for that. I guess that highlights where the power actually rests with the people. And it's really up for us to recognize that or not. So just, if anyone has any closing remarks, I don't know if Shaun or Suzanne, just anything that you would like to leave with the audience in terms of, how we can move forward. Jennifer? Yeah.
Yeah, I'll just say quickly, as an action with this movie, I made it to share. I made it to not make money off of it. So please share it with people, especially skeptic people in your life. Like, I tell people, if you have a cousin or an aunt or somebody you don't even talk to anymore, or someone close to you that you have a hard time communicating with, that I ask people, like, send them this movie, because I made this, as soft as possible. Like, I'm not here to blame people. This isn't an echo chamber movie to make people mad. It's a movie to make people aware, because there's a lot of ignorance out there. There's a lot of people who don't understand what's happening. So, and I even tell people, if you can share it with somebody and just for heartfelt say, hey, watch the first 10 minutes, watch the first 15 minutes. And then if you really don't want to, don't watch more. Even that will make a difference, because once people start seeing things, they cannot unsee them. So that's how I say, like, have compassion, share the movie. I'm trying really hard to get it on left-wing stuff and do press and work with the publicists. And so, on the website, there's a way to see the movie. I don't know how you're doing it in Bermuda, if you're going to keep showing it on Mondays, and you'll talk about that. But it is available on the website to share. And also, if anybody's so inspired, you can make a donation to kind of help with the marketing of this movie. That's where we are right now. And then just the last thing I'll say is, I appreciate the discussion, and it's such a heated discussion. So I appreciate the woman who stood up and said what she wanted to say. And when I hear that, my blood is still raised from what she said. But that's okay. Like, we have to be able to hear and listen and understand. And I think if that was a question rather than a statement of that we all knew, like, we didn't know. And that's the point. There's a lot we don't know. There's a lot of censorship. There's a lot of blindness. There's a lot of people who don't have time. And I had surgery 2 weeks ago, and it had nothing to do with my vaccine injury. With my doctor I've had for 18 years, who I trust more than anything. She got me through precancerous treatment like 8 years ago. She did a surgery with me 12 years ago. I love her. She's amazing doctor, but she's a specialty doctor. So it didn't go to her for my vaccine reaction. I never talked to her about it. She's putting me under anesthesia 2 weeks ago. And we're talking while I'm waiting for the anesthesia to go in. And that's when I decided to tell her, so I made a movie about vaccine injury, because I just trust her. I mean, so much. And like, we haven't, and she's like, oh, and she listened for a second and she was like, great, people need to hear. And then she went on to the typical thing, like, yeah, vaccine reactions happen. They are rare, but also reactions happen to the COVID. When you get COVID, you can get long COVID. And she just went on to all that talking points. And it really opened my eyes right before I went into anesthesia. But I was just like, I trust this woman more than anything. She's gotten me through like pre-cancer diagnosis. And she is a wonderful human being, and she's a great doctor. And in her heart, here she is telling me the talking points about how COVID is bad and the vaccine might be worth it. And she 100% believes that. And if I hadn't done research of my own and didn't have my experience, I would trust this doctor. We trust our doctors a lot. Some of us do. If you have a good doctor like I did, I've had her for 20 years. So that's just as I was thinking, it hit me really hard. I trust her. And if I was somebody who was just looking for my doctor to tell me what to do, because there's so much information, I would have trusted her, and she would have given me the information. Get the shot. It's going to help you. It's beneficial. And she would say that 100%, thinking she was right. And she's a good person. And there's just a lot of different information, and there's a lot of things we don't know, and a lot of things we're not being told, even the doctors. So, and thank you guys for coming.
Yeah,
and
yeah.
for being a part of this.
Thank you very much, Jennifer. Any other closing remark? Shaun?
I just wanted to say, I also do appreciate the person standing up and voicing, because I do believe everybody has a right to their own voice and their opinion. But what I would say to that is, yes, we all have free will and we all make decisions, right? But I think what that person doesn't know is that this situation is very unique. So imagine somebody who makes the bad decision to smoke and gets lung cancer, or the bad decision to drink alcohol, even though they know that it's bad, and they get liver failure. Those people still get treatment. They get respect in the medical system. They'll get treatment for their cancer. If you swim in the ocean and you get bitten by a shark and you survive, you're going to get treated. If you are vaccine injured, you're getting almost nothing. So I am financially ruined. I had to fight for health care. I had to fight for people to believe me. We are like roadkill. I don't know if you know what that is, but it's like you are collateral damage. So, and the thing is, I knew, right? So I'm a researcher. I knew the risks. But I was also mandated. My hospital mandated it. So it was either take it or I lose my job and my career, right? So there's a lot of nuances there. But I do think there's a big difference between knowing and trusting and then being left for dead. And it's a very unique situation.
Thank you very much, Shaun. Suzanna?
Yeah, I'll just kind of to change the dialogue a little bit. I think Jennifer and Shaun both kind of hit that nail on the head with their comments. You have to have comfortable conversations. What I hope for is that instead of pointing the fingers at each other, we look for more corporate social responsibility. Corporations, pharmaceutical companies, big pharma, big government, all have a lot of money. Those of us injured, and probably those of us not injured, don't have a lot of money. And I think there's plenty of money there that could go towards research, towards support of those that are injured. But I want to leave on a different note that for those people who are injured, and maybe there are some in the crowd there, like you are not alone, and your body is really built to heal. I know it's probably been a long time for some people, but your body knows how to heal, and it's working hard to do that. And I hope you look for resources like react19.org. Here in Minnesota, we have Team Humanity. I hope you build a community of people there, both injured and not injured, supporting each other and really holding each other up. Because it is about coming together. It's really about humanity here and seeing each other and supporting each other through this. But please know that you're not alone.
Thank you very much, Suzanna. And Dr. Parks, did you have any closing remarks?
I would just like to echo Suzanne's remarks. I'm not vaccine injured. My children are not vaccine injured. But it was really sad to hear Jennifer talk about some of the things that people said to her. And it's kind of shocking to me. I'm very much in the vaccine injury community, and all of those people took vaccines, right? So they at some point were somewhat at least pro-vaccine. But what you'll find is, when you're injured, then that is the time to support one another. You don't walk someone, walk down the stairs and break a leg and go, "Oh, you idiot, you don't know how to walk downstairs." You help them. And so we're here to help and support each other, to listen to each other. And I think validating our humanity is the most important step we can take going forward, validating each other's humanity.
Yeah, give thanks. Yeah, thank you to all of you, and thank you to everyone here. And your comments, Dr. Parks, just reminds me of a conversation I had with a doctor here. We invited over 100 doctors. We invited, the Premier, the Health Minister, the Director of the Health Department, backbenchers, current ministers, shadow ministers, on and on and on. And I had a conversation with one local doctor. They said, sure, I'm happy to come. And then they said, well, as long as I'm not going to be blamed for everything that the people in this movie are going through. And I was like, well, no, this is not the purpose of this event. This event is about raising awareness, starting a conversation, getting to a point where the people who have been injured are acknowledged, seen, for real. Getting to the point where it's okay, we actually have vaccine-injured people in Bermuda right now. And the more people we have in the room that can contribute to finding solutions for that, the better. And it's going to take everyone, because we all have different skill sets, So this event was about starting a conversation and raising awareness. And what Jennifer said about sharing the movie, yeah, the movie actually is free, but we wouldn't get any media attention. We wouldn't get all of you out here if we just said, go on YouTube and watch a movie. We had to create the spectacle to draw the media attention, to have press statements and things that went out in the community, and create this type of event that was able to, fortunately, fill the theater. So hats off to all of you, and you all deserve a round of applause for coming through. And the doctors that are in the room, really appreciate you coming out, because it is a very tricky and divisive topic. And for those of you who have been injured or know people who have been injured, hats off to you as well, because it's been very difficult to talk about what's been going on. Just like Jennifer was afraid to share her movie, people have been afraid to talk about what's happening to them. And when we watch movies like this, and I was taking notes while watching it, and I've seen it several times, but, we could say, okay, well, that's in America, that's not really in Bermuda. Well, let's think about the things that came up in the film. Threats on doctors, yeah, that happened here. Watching patients die after being unable to treat them. I know quite a few cases of that. Literally, doctors watching patients die while our hospital told them that they could not treat them. That happened. People suffering injuries immediately after taking the shots. That happened. People who have been air ambulanced out of the country after taking the shots. That happened. While being denied on local TV in our press conferences. People dying after taking the shots. That happened. People getting blood cuts. People passing out. Right? People dying in their sleep. That's happening. Right? Myocarditis, pericarditis, both happening in Bermuda. Athletes unable to compete anymore. People who were extremely fit who lose their breath walking up steps now. Right? Pediatricians advocating for kids to take the shots. That happened. The hospital promoting for pregnant women to take the shots. That happened in Bermuda. Media censorship, that's still happening. I lost count of the press statements that were written that never made it anywhere. And even the press statement about this was only covered by 2 media outlets. So we had to share the information ourselves. So thank you for all of you who shared the information. Because without that, a lot of you wouldn't even be here. So one of the big challenges, and it's still going on. Yes, they are. So the other thing is that a lot of the institutions that have been put in place to protect us, and this is really this is what Shaun's talking about, and Suzanne and Dr. Parks. A lot of the institutions put in place to protect us, right? They did this. They just walked out of the way and watched it happen, right? The police was approached about crimes against humanity. They did nothing. They said they could do nothing. The Human Rights Commission said that they can help you with anything except for COVID. It's not a human rights issue if it's COVID. Yeah. It's very interesting and all this happened in Bermuda. Death rates are soaring in America and Europe. It's happening in Bermuda. And it's not in the news. More people are dying now than during COVID. We had tickers up where you could see every case, every death on a daily basis. You couldn't escape it. Now it's nothing. But in the data that's going around, like some of these cohorts are showing like raises of over 200% in mortality. And not just in the older people, in middle ages. No reports on it. So these things are happening here. And again, I'm thankful for everybody for coming out tonight. It's not about being angry. I know sometimes I get very passionate. I'm not really angry. I'm just very passionate. And I really appreciate Suzanna, Jennifer, and Shaun. You know, it's not easy to step out and put your face on a position. And a position like this in particular is very difficult. So hopefully their actions have inspired others. And hopefully now we can leave here and feel driven to make positive change, because all of us have the capacity to do that in our own way. So again, thank you everyone for coming. I've really enjoyed this experience. We have another screening next week, Monday, you know, and we will share the film with everyone in the public. And I'm going to look forward to talking to you about that public screening as well. Yeah. All right, but thank you, everyone, and have a good What's that? Oh, I'm sorry, we have one more statement, and I'm sorry, I'm powerless to deny this person from speaking as my mother.
Eugene, good evening, everyone. Eugene has worked very hard, and for all of the people who have helped him to bring this to fruition, I'd like to say thank you very much, and give him a big round of applause, please.
Yeah, you gotta love mothers, don't you? Yeah, thank you. All right, everyone. Have a good evening. And thank you guys as well. Thank you, Jennifer. Thank you, Susanna. Thank you, Shaun.
Thank you.
All
Bye.
right.
Thank you.
Take care. We'll be in touch.